The New York City nurses took to the streets to protest against the medical supply shortages, and the medics demonstrated outside their hospital in Bronx and demanded immediate supply of personal protective equipment like masks and hazmat suits. And nurses said that they face a tough choice between their moral responsibility of saving lives and their personal health, as well as that of their families.
It's literally frightening when you walk in there. And that, I mean, if you're spending half your brain power worrying about if you're going to die, you're not concentrating on the patient because you're just worried about not dying as you go in there. And it's very difficult. And now the ratios are even getting more. I mean, management says they're going to one nurse to 10 patients. It's sheer absurdity. It's sheer absurdity.
In fact, authorities have even asked nurses to reuse masks, putting their health at risk. Remember, it is advisable that masks and gloves are changed several times in a day at least, as far as hospitals and medical staff is concerned.
They gave us one on Monday, one on Thursday. Turn in your old one, you'll get the new one. We said that's unacceptable. Now they're saying they're going to give us one a day, where normally we would use many in a day to take care of patients. They're talking about re-sterilizing them under procedures that are not scientifically proven to be effective.
Right, and William Denslow is now joining us live from New York for the latest on what's happening in the United States. And well, William, the number of dead is just rising every day. And let's talk specifically about New York, where the mayor has already warned, as has the governor, that Sunday may be the D-Day, the day when the city will run out of ventilators and the healthcare workers will really feel the strain of the battle against COVID-19. But what is the plan really here, if there is any?
The plan is to get as many supplies as possible before New York reaches an apex. Now, Bill de Blasio, New York City's mayor, warns that this D-Day, as you so rightly mentioned, could come as early as Sunday. He says that supplies are really needed by then at the earliest. And then after that, if we start to run out of supplies here, he warns that hundreds, if not thousands, more people could die. Of course, over 1,500 have already lost their lives in New York City. Over 2,000 in the state of New York have lost their lives, making it very much the epicenter of the COVID-19 outbreak here in the United States. Now, we've heard from the governor of New York, Andrew Cuomo, who says that he believes that he gave this six-day timeline that he fears that on the current trajectory, New York could run out of those life-saving ventilators. Of course, that statement was made about 24 hours ago, so now that timeline is about 5 days. He says that all is being done to try and procure not only more ventilators, which he says are absolutely essential, but also more beds, as well as more staff and more PPE, that personal protective equipment for those working on the front lines against COVID-19. He does, however, say on the topic of ventilators that there are some potential fallback options, such as splitting ventilators for use, also turning anaesthetic machines into ventilators, not as effective, but potentially could be used in a pinch if absolutely vital. But the overarching message from officials here in New York is that they need supplies, they need them now, and they also need more people to engage in social distancing, to get people off the streets more, to stop the spread of this virus.
Right, and of course there's been much criticism of the Trump administration, which has gone from denial now to panic mode possibly. The US government coming up possibly with new guidelines as well, as you said, social distancing, advocating the usage of masks, and also the nurses they're pointing out they're being asked to reuse masks as well, even as 1,000 US service members themselves have got infected.
Absolutely. The message from the Trump administration is that they're sending the supplies that are needed in these states, especially New York specifically. Officials here in New York say they're at least supplied with enough personal protective equipment for the immediate term as well. But of course, there are fears that this apex of cases could hit at the end of the month. So there are real question marks whether that'll still be the case when it comes to having enough supplies in a few weeks' time. That is a huge area of concern. You mentioned efforts from the Trump administration when it comes to more social distancing measures and more public health measures. Well, the Trump administration is expected to roll out more guidelines when it comes to wearing face protection, people to cover up their faces when they leave the house. Now, this is something that's already been asked for by New York City's Mayor Bill de Blasio. He says that he has urged all residents in the city to wear something like a scarf or a bandana, anything that's made out of cloth to wear on your faces when going out in public, especially in areas of close proximity to others, namely things like grocery stores and pharmacies as well. He did, however, urge people not to wear masks, surgical masks, and those N95s that are so critical to those medical care workers working on the front lines. Of course, the interesting thing with this is this just comes a couple of weeks after the likes of the US Centers for Disease Control and Prevention urged Americans not to buy masks, not to wear them unless they were sick. So these certainly seem as very strict measures being taken into account to try and stop this spread.
Right, absolutely. And William, thanks very much indeed for joining us and sharing the latest on what's happening on the ground in New York, and really troubling times for everyone across the globe. Thanks for that.